Hello, today's discussion by Dr. Willis centers about PSA testing. The question, conundrum, what should primary care physicians do? There's a huge question about PSA screening as a routine part of a physical exam for a male. The data is questionable, but actually, from the urologic point of view, quite substantial. There is no question that PSA testing, follow-up, and ultimately early diagnosis of prostate cancer led to a huge drop in prostate cancer mortality in the United States over the past 30 years. However, since then, as the mortality rate has dropped, the question is, should we still be doing them? Do they really help? Does every man who have an elevated PSA need a biopsy? And if so, the risks from the biopsy, do they outweigh the actual diagnosis of prostate cancer? For many years, it was thought that men die with prostate cancer, not of prostate cancer. However, over the years, particularly since PSA testing became more routine, we've begun to understand that early diagnosis, early treatment, and certainly continued follow-up has led to a decrease in mortality in men from prostate cancer. At one point, it was felt that maybe it isn't necessary, but an Austrian study showed that by doing PSA testing, mortality from prostate cancer dropped nearly 40%. Early diagnosis saves lives. When should a primary care begin? A primary care should start testing at 50 years old in males. Doesn't need to be every year, certainly every couple of years. And certainly the question becomes, if it is an elevated PSA, do they need testing further? Do they need biopsy? Is the risk greater than the outcome? New aspects of testing have changed those questions. PSA testing is not necessarily as it was in the past. An elevated PSA on a routine screening then can be evaluated for complex PSA, meaning we can break down the components of PSA to increase the diagnostic prognosis and outcomes based on percentages of free versus bound PSA. Additionally, when men hit 70 years and older, PSA numbers change. PSAs have a greater number that's considered normal, for example, up to 6, than in a younger male. Probably the most important question about this is, do a PSA testing that's elevated, does that require a biopsy? And the answer is not necessarily anymore. MRI scanning has become much more improved, and it is an easy way to diagnose the risk of a prostate cancer being in the prostate itself, and if so, then a biopsy can be done. Additionally, if it turns out to be cancer, because an MRI is done, we've had mapping of the prostate and we know where the tumor is, so we can now do focal therapy for prostate cancer. We do not need to take out the entire prostate gland anymore at this point. I am an advocate of minimally invasive procedures, which have shown to be quite effective in early prostate cancers, and as such, have a decreased risk of mortality and also morbidity from treatment than in the past. Finally, I would suggest PSA testing should be a routine part of all males who undergo routine physical exams and yearly exams. Follow-up, of course, is based upon the need, for example, elevated PSA based on risk range, but also the fact if there's a family history of prostate cancer, it is imperative that we repeat and continue doing PSAs on a screening basis on these men who are of a high risk potential. If you have any further questions, please don't hesitate to email me. Thank you very much.